I'm talking with Dr. Nada Elbuluk, dermatologist within Keck Medicine of USC. And Nada, it's wonderful to see you.
Thank you. It's so nice to be here. Thanks for having me, and I'm honored to be part of this conversation series.
Well, I look forward to the conversation. And so you head up the USC Skin of Color and Pigmentary Disorder Program. Tell us about that program.
Yeah, so I specialize in skin of color conditions and pigmentary conditions. And so when I came to USC a couple years ago, I really had a vision for creating sort of a premier center that really specialized both in a clinic and a research standpoints in conditions that affect skin of color and pigmentary disorders. So I had the support of my chair, David Peng, to do that, and we've really been able to build and are continuing to build a really wonderful program that's here to take care of the needs of this unique population who really have special dermatologic needs. And we're fortunate here in LA that we live in such a diverse city, and especially in USC, I feel like we're in the heart of such a rich, diverse area. And so we're really here to take care of people of all backgrounds with all skin types, and as well as their hair and nail conditions as well.
Wow, and I understand it is a unique program. There are not many like it in Southern California, let alone across the nation. Can you speak a little bit about that?
That's right. So we're actually the only academic institution in Southern California to have such a program, and there's only about a dozen clinics such as these in the entire country. And ours is one of only a few in the country that actually have both the clinical and the research component. So it's really a very unique, comprehensive program that I'm very excited to be building here and very excited to offer to the patients of Los Angeles.
What are the types of situations that you see, in your program in terms of where folks may be lacking some of the access to care in the special things that you do within the program?
So there are some conditions which uniquely or disproportionately affect people of color. Yep. And there's also conditions that can affect anyone, but which look or present differently in people of color. Okay. And I'll give you an example of each. So for the former group, you can have individuals that have a condition such as keloids. Keloids are a scarring type of condition that happens primarily in people of color and primarily in people of African descent. So up to 16% of the African population can have these keloids. And keloids basically are when your body forms a scar after a cut or trauma, but it doesn't know when to stop. And so it just keeps forming. And so you get these very sometimes large, disfiguring and symptomatic areas of scarring, which are really very distressing to individuals that are affected. The other category of conditions I mentioned are things like acne or eczema or psoriasis. These are inflammatory conditions that anybody can get, but that can present differently in skin of color. And the reason for that is that our melanin, which is the pigment that gives us all our skin color, the melanin masks a lot of that redness. So the way it looks in a darker person might be more brown or purplish. And so that person may have very active disease, but if you've never seen that disease in someone of darker skin, you may not recognize it, or you may not recognize how severely it's affecting them. So patients get underdiagnosed or misdiagnosed or undertreated. And so again, because we have the training and background, for this, we're able to provide patients with very comprehensive care across the board for all types of conditions.
Part of it is an awareness issue too, isn't it?
Yeah.
In terms of just education about skin conditions and when to see a dermatologist. I know you're doing some work in that. Can you talk a little bit about that?
Yeah, absolutely. So education is huge. A lot of people, there's a lot of myths that we have to dispel out there. A common one is that a lot of people of color don't think they can get skin cancer. And skin cancer, unfortunately, can kill people, if not caught early enough. And people don't realize that. So a lot of patients of color never even see a dermatologist for a skin exam. It's not even on their radar that they need to wear sunscreen and that they can get skin cancer. So even though the rates of skin cancer are lower in people of color, when they are diagnosed with it, it's often at later stages and often with higher morbidity and mortality. And that's something we really need to change, because if you catch skin cancer early, it's treatable. If you're protecting yourself, it's often preventable. Doing education in that area is so important so that people have that on their radar. If they see something that's changing or discoloration in one of these areas or anywhere on the body, come in. Let's have us look at it. Come in early. Don't wait.
What drives you? What gives you your passion to do what you do and do it so well?
I had a love and passion for medicine from a young age. I had from middle school, actually had shadowed my own pediatrician and decided I want to take care of people in medicine. And, growing up, I also was very involved with a lot of diversity, equity, and inclusion types of groups. And so, coming from a unique background myself, and my husband has a unique background, we really have always celebrated people of different backgrounds, and whether it's different races, ethnicities, gender, sexual orientation, I really am very passionate about diversity and equity inclusion. And so I bring that passion into my love for medicine and wanting to make sure that all people receive the best health care possible. And so I'm very big on health equity and improving health disparities, particularly for those communities that have been the most marginalized, and a lot of, that overlaps significantly with communities of color. So myself, coming from a minority background, it's been really one of my missions in my own career to make sure that these populations are taken care of, that their voices are heard, and that their health issues are taken care of.
Oh, that's wonderful to hear.
Yeah.
And wonderful to hear all that you're doing. And I want to thank you so much for being with us today. And we are very lucky and blessed to have you here at Keck Medicine. Thank you.
Thank you.